Almost starting.
Okay, and we're there. Well, we want to welcome everybody to the Thinking Minute, a name which
Our
my daughter made up, of course.
official, unofficial name, right?
Yeah, right. No,
If
absolutely.
anyone has any ideas, we're open.
Yeah, that's not the best idea, so we can certainly come up with others. So just what we'll do an update, and then we will do question and answer, and we will see your questions on the right side. We'll probably won't be able to get to all of them. And then we were going to talk a little bit about what to put in a home emergency kit if somebody in your household has coronavirus. So hopefully everybody's in. We have a lot of viewers, and we'll go ahead and get started. So beginning with an update, the first thing I thought I'd talk about is what is the death rate? We've been hearing now for weeks that as we test more people, that the death rate is going to plummet, that so many people have coronavirus that it maybe is no worse than the flu. Well, as of about 10 minutes ago, the US death rate was 3.9%. The world death rate was 6.2%. So as we're testing more people, for some reason, the death rate is going up. So this is serious. This is not something that is going to be a flu death rate of 0.1%. As I speak right now, the death rate is currently 39 times out of the flu. Hopefully it will come down, but it certainly hasn't yet. If you look at Spain, Italy, and France, all of them are over 10%. And there are now more and more test cases out there. So it's a problem. I mean, right now in the United States, they're talking about normalizing things as of May 1st. And I think that that's going to be a very difficult thing to do. I think that's going to have to be done when there is widespread testing available, when there maybe is a treatment available, and certainly a vaccine won't be available to 2021. I believe we are flattening the curve, and I'll post curves later showing that the US curve is flattening. But that does not mean that cases are not increasing. It just means it's no longer logarithmic. When you flatten the curve, what hospitals are able to maintain some control. And I think we've done a good job in the US with that. Certainly, at least in California, the hospitals are by no means overwhelmed. But even if you flatten the curve, it doesn't mean you can't go out there, get coronavirus, and be in one of those hospital beds, whether they're full or not. So this is still really a disease we've got to avoid. It's tricky, and I just don't see that in 2 or 3 weeks that we're going to be back to normal. I don't see that at all.
I don't either.
A second thing, if you're an asthmatic, there has been starting to be a shortage of albuterol inhalers. There was a new generic albuterol inhaler that was released 2 days ago, and I think it's called ProAir, which is actually an old name, or something like that. But please, if you're an asthmatic, you've got an expired inhaler, please go ahead and refill. There was an article released a couple of days ago on remdesivir. That was the medication that was used in Ebola, and in a fairly decent-sized study, remdesivir had a 68% success rate. And if you were on a ventilator, 82% of people got off, whereas normally it's really only about 30%. So remdesivir has had some success, but there was a problem. Gilead, the company making remdesivir, is no longer making it available for compassionate use. That means to get remdesivir, you've got to be in a clinical trial, and not every hospital is enrolled in that trial. So if you are going to be hospitalized, you might want to check and see if they have access to remdesivir. Hydroxychloroquine is still a thing. Most people going to the hospital are getting hydroxychloroquine. Do I believe it's working? I think the jury's still out. Let's see, we'll talk about, there's now really good proof that asymptomatic people can transmit coronavirus. So for about the first 4 days to 10 days before you're even symptomatic, these people can still be high transmitters, which is one of the reasons why it's going through the community so quickly. So that isn't just a theory, that is now an actual thing. And one of the reasons we've got to be very guarded and careful with this illness. Sarah, any questions on that? Or?
Yeah, so one thing that you said at the beginning of the update that I think, we should dwell on is this whole idea of this is not the flu. And I was wondering if you could just speak a little bit more to that about how this isn't the flu. The death rate is higher. The flu doesn't kill this many people a year, and in this much of a quantity. So can you just harp on that for a little bit? Because it's a really important point.
Right. Well, how is it different? Well, for the flu, it's a virus. It isn't a coronavirus. There is a treatment. There is Ofluza. There is Tamiflu. There's a vaccine that is available. We don't have any of that for coronavirus. The current death rate of flu is felt to be about 0.1%, But we're not going crazy testing people for the flu. So, if we did, maybe it would be even lower. So, no, this is definitely not influenza. Influenza in a bad year, I think in 1918, it killed 1% of the Americans that were infected. And now even now, we're still 4 times higher. And maybe that number comes down, maybe it doesn't. But, every week when I report to you, that number seems to be trending up. We've got to be very careful of this. Definitely not influenza. Right. Any other ways you were thinking, Sarrica, to talk about? Or?
Well, yeah, I just think it's important to realize that when people say this is the flu, that there actually is treatment for the flu. And right now in coronavirus, there is not a certain treatment. There are things that we're trying, and thank goodness we're seeing good results there. But just like to very differentiate the fact that the flu and coronavirus are not treated the same way. So you don't want to get coronavirus and assume that it's just the flu.
Right. And I also think my fear is that over the next couple of weeks, with this May 1st deadline looming in the United States, that this will become political. Republicans generally are favoring an earlier return to work and normalcy than Democrats. This is not a political issue. Politics should have nothing to do with this, of course. I mean, I really think we can't get back to where we were until we've got really universal testing, until we have some sort of treatment and maybe even a vaccine. But testing would be key, because then you'll know, maybe we'll give people certificates to say you don't have it, you've had it, and you're cleared. But people that have had it and are cleared are probably the first people that will be able to return to work. Whether they're immune, how long the immunity will last, nobody knows. Whether they can be infected with other strains, nobody knows. It's still too early right now. So there's so many unknowns before we actually get everybody to return to work.
Yeah. So we're going to segue from updates to the Q&A section. And then later we'll talk about the at-home toolkit. So I want to open the floor up for you guys to start posting your questions in the comment box. Again, I will do my best to answer them. We do have some questions previously, but Dad, like what you were just saying, a lot of people, the question I get is, if you get it once, can you get it again? Are you immune? And again, it's important to realize that we don't know yet.
Right, I think that's key. And I think there was a video that was trending where a woman was saying, I had it, and then I tested and I was negative, then I tested and I was positive. If you look at some of the Chinese data, they had stool swabs where people were positive for 43 days. There's also a lot of false negatives. Now they're estimating the false negative rate on these tests might be as high as 30%. So maybe the people are testing negative and positive, or maybe if they test positive, that they're still not really contagious. Testing positive and being contagious are two different things. You need a certain amount of virus before you're going to get it anyway. So it isn't clear that that positive test after 2 or 3 weeks means that person is still contagious.
Right. And then one of the questions that we just got was if you can speak to the role of antibody testing in the next phase of the response. That's been a huge thing.
Right, I'd be happy to. So there's IgM and IgG antibodies. The IgM antibody is the first antibody that develops. One of the first things we can detect. The IgG,
like the mommy antibody.
Yeah, right. It's the first antibody that comes out. Then the later antibody is IgG, and most people feel that by the time you're making IgG antibody, the IgM goes down, the IgG comes up, but you're probably immune to that strain. On the other hand, there's many tests out there. The FDA is rapidly proving these. It doesn't mean they're accurate. And for the antibody tests, I've seen false positive rates of up to 50%, meaning it may be garbage in, garbage out. You may be getting a result that has no basis in reality. So whatever antibody test we have has got to be accurate.
Right. Okay. And let's segue now into some of the questions that we had previously, and then I'll go back and forth. Again, just to clarify, for people who are going on runs or for walking their dogs, what are the best practices?
Sure. And the best practice, the question is, should you wear a mask? Well, if you're outside, it's a little windy, it's going to blow anything away. But I think wearing a mask just keeps you from touching your face. It reminds other people that you need to wear a mask. I mean, here in Los Angeles, it's now required that if you've got to do anything that you wear a mask. It may not be walking your dog, but if you're going to the store or anything like that. So yeah, I think wearing a mask is important. For those reasons, but no, if you're really isolating, there's no one else around, you're probably not going to get coronavirus walking your dog down the street.
Right. And there's also a lot of talk about how, when this first started, everyone was saying this is a droplet virus. You can get it through someone sneezing or coughing. And now there's some talk about it being just airborne, meaning it can travel in little particles throughout the air, which is why they're also saying we should start to wear masks. So what do you think about that?
Well, it is, but when we talk about airborne, what does it mean? I think if you enter a room and you've got a mask and it's not an N95 and there's people in there with coronavirus, that's probably a much higher chance of getting it than if you're running outside. So I think it also depends on location. I think yes, that's true. It isn't just droplet; it is airborne, but not airborne to a huge extent where we're going outside to get the paper, you're going to get coronavirus. It isn't that kind of airborne.
Right. Okay, and then also with new theories that people are talking about, especially in California, we haven't really heard this in Israel, but there's this topic of herd theory, right? So can you talk about what herd theory is and its place in the COVID-19 epidemic?
Sure. The idea of herd theory is that when 60% of the population have antibodies to coronavirus, that the amount of coronavirus in the community will begin to decrease, because even if you haven't had it, it's going to be hard to find somebody who actually does. So that magic number is about 60%. There's studies going on there right now to figure out exactly how many people have been exposed. For instance, in Los Angeles, there's a randomized trial underway of 1,000 people. They're going to test them and see, okay, you don't have any symptoms. Have you been exposed? I don't think that number is going to be that high. Another question that gets asked, well, did I have this in December? Did I have in January? Did I have in February? And the answer to that is probably no. The first cases in China were at the end of November, early December. It wasn't known before then. Furthermore, if you think about it, in January and February, we didn't have people going to the hospital with a viral illness and getting intubated. That didn't occur. It wasn't a thing. We had a lot of influenza A and influenza B, and I saw a ton of that in January and February. That's probably what you had. And I thought it was a particularly bad flu season, and now we have this on top of it.
Okay. And so what about a second wave, right? We're talking about all these vaccines and all these medications for this strain of coronavirus, but are we seeing any indication that, curve's kind of flattening, but maybe there's a second wave that will come?
Well, right now we know that the total number of cases, they're still increasing day by day. The curve is flattening, but we've not peaked yet. And different parts of the country will peak at different times. New York will probably peak within the next few days. California will not be for a while. I just saw an estimate that Washington, D.C., they're looking at June. So different cities are going to have different times when they peak. It will happen at different times all around the country.
Okay.
So whether the question about the second wave in the 1918 influenza epidemic, there was definitely a second wave. Will this occur with coronavirus? It's too early to tell. But I'll tell you one thing for sure: if you want to have a second wave, for sure, stop social isolation. That for sure will cause a second wave. So we're doing our part. We've lowered the heck out of this. I mean, the death total in the United States has just been reduced. The estimate has just been reduced from 110,000 to about 60,000. So we're doing great.
Wow.
If you want a second wave, stop doing that.
Right. And so I guess based off of that, do you think schools will, be ready to go back into session by September?
I don't know. I think it's a great question. They're certainly not going back this year. That I think we can pretty much guarantee. By September, hopefully you've got a widespread antibody test, and maybe you need to test all the kids who's been exposed, who hasn't been exposed, and who has it. If you can effectively isolate those that have been exposed or that have the illness, you'll do a better job. I hope we can get the kids back by September, but part of me doubts that.
Right. Okay. Again, if you're submitting questions, I'm doing my best to see them. So just keep them coming and we will do our best to answer them. And then again, Dad, can you just clarify how the time frame of the virus works? So once you feel sick, how long do you have to wait until you don't feel sick to be considered, non-contagious anymore?
Right. I mean, it really depends. The CDC recommendation is that from the first time of symptoms, you wait 7 days. Then plus 3 days when you've not had any symptoms. For instance, no fever, and not a fever controlled with Tylenol. No fever when you're not taking anything. So at least 3 days from the absence. In California, it's 10 days and then an additional 3 days. And then other people are using antibody testing. I just saw a study last night for healthcare workers. They're recommending if you're exposed, you wear a mask for 14 days. So it's variable depending on who you listen to. To me, a fair compromise would be about 14 days from the onset of symptoms, providing at the end of that 14 that you're completely asymptomatic and not taking over-the-counter medications.
Right.
But even then, we don't really know because people still are testing positive. So there's that.
Right. And then what's this whole dilemma about, whether you should take Advil or Tylenol and which one's better? Does Advil make it worse? Some weird stuff going around.
And this goes about 3 weeks ago when there was a brief thought that maybe that things like that anti-inflammatories made the clinical outcome of coronavirus worse. I don't think that we believe that much anymore. I'm telling my patients to start with Tylenol, but I think if Tylenol doesn't work, go to Advil, go to Aleve. There's no good clinical data indicating that they're harmful or that they particularly influence the outcome one way or the other.
Why did that conversation even start?
Because at the start we had studies of 10 people, 20 people, and you were discovering different things, much of which probably weren't true.
Okay.
There's a group of antihypertensives called ACE inhibitors, A2 blockers like valsartan, and there have been conflicting data on whether they increase the chance of getting sicker if you get coronavirus, whether they actually improve. So I'm telling patients, listen, if you're otherwise doing well, don't do anything. I don't think I'd necessarily put somebody on a new medication like that at this time, but I'm not taking anybody off either. Again, we just don't have the data to say stop that class or don't stop that class.
Okay, and that makes sense. We're really at the beginning of this, which is crazy because it feels like forever.
Well, it does feel like it's been forever, but I think the American College of Cardiology is not recommending that patients stop those antihypertensives.
Okay, cool. So, Dad, I feel like we're ready for the next phase, which is talking about what to put in your at-home COVID-19 toolkit. My dad actually sent me this. Yeah.
And this would be if, let's say somebody in your home, God forbid, tests positive for COVID-19. I mean, what do you do? What should you have? How are you going to handle that?
Yeah, so we'll get into all the nitty gritty. I just want to give a shout out to the Washington Post. This article was written by Hillary Potkiewicz. I'm very sorry if I mispronounced that. I probably did. Who basically got a bunch of different opinions from a bunch of different doctors on best at-home practices. So we wanted to kind of help break that article down. But Dad, definitely post it to your page once we're done because I think it's
I will. I try.
Okay, so if you want to get a pen and paper, now is the time to do so. We are going to go over what supplies you should have in your house. And believe it or not, but toilet paper is just not on the list. Crazy amounts of
because you generally have a lot of diarrhea. So why do people use so much toilet paper? It turns out when we're all staying home, if you stay home and you don't go to work, actually households are using 40% more toilet paper because they're home. So I thought that was interesting. I wondered why.
I think because we're bored, maybe? I don't know. Okay, and the next thing, we will go over what the patient needs in their room, what your family can do to kind of keep a distance from that patient, and what to do if you have a shared bathroom, and medication, and some, nutrition tips. All right, so we're ready? Okay, so the first thing are supplies. This is on the list. Bleach. Bleach is a great tool to use for disinfecting. Face masks. I really want to make an important note about face masks. I know in the past we were saying that you can use a bandana, but it's actually really important that whatever you do use around your face closes in on your whole mouth. So if you imagine a bandana, it's kind of like a beard and this whole area is open. So we want to make sure that wherever we're using to cover our mouths is really sealed, and do the best that we can with that. The second thing,
but remember with the bleach, you can make a cleaning solution. If you take 5 tablespoons, don't use just pure bleach. Take 5 tablespoons of bleach and dilute it in a gallon of water, and you have a cheap cleaning solution.
Yeah, I'll get into all the specifics.
Okay.
And we need gloves. So hand sanitizer is helpful too. But if you are, allergic to latex, there are other kinds of gloves that you should definitely consider. Laundry detergent. Some people suggest a nail brush for cleaning under your nails. If you're like me and you like gel nail polish, actually not so clean. We weren't allowed to have them on the unit in the hospital. So maybe, hold off on gels for a little while and get in there with your nail brush. Paper towels, soap, regular hand soap, and tissues. So that would be our shopping list. So
I mean, I've never used a nail brush. I don't even know.
I've never used one either, but you know what? I feel like, what else are we doing? We might as well try nail brushes.
Might as well brush our nails. Okay.
We're going to see like new fancy nail brushes popping up on the market. It's the time to invest in nail brushes. Anyway, so if you are living in a house with somebody who is sick, obviously it's important for that person to be quarantined. So what does that mean? How do they navigate around the house? How do they go to the bathroom? We will talk about all of that. For the patient, the person who is sick, for example, if you are living in a 1-bedroom apartment, give the sick person the bedroom, really quarantine them off. And if you're married to them, separate from them. Don't sleep in the same bed just because one of you is sick. I would sleep on the couch, or just, really distance yourself. In the room,
person gets the bedroom.
What? The sick person gets the bedroom.
Right.
Which seems fair. I feel like,
because you can close off the door, right?
Close off the door. They're in their own separate area. So in that room, we're going to stock it with some tissues, some disinfecting wipes, paper towels, soap, water. And of course, it's not always possible, but if possible, the room that, the sick person is quarantining in should have its own bathroom. I think that's pretty obvious, but so what if you can't have your own bathroom? If you can't have your own bathroom, everyone who is sharing the bathroom should actually remove their toiletries from the shared space. You don't want to leave your toothbrushes out. You don't want to leave your makeup brushes out. Anything that's touching your face, I would, use that bathroom like you're in college when you kind of run to the bathroom and run back, make your own little kit. Sick people should, use paper towels. Don't really share any of those cloth towels. But if, of course, paper towels are running low and so is toilet paper, it's okay to just have your own separate towel in your own section. And if you are sick and you are using that bathroom, take a few disinfectant wipes with you, give everything a good rub down. And if you're the next person coming into that bathroom and you're living with someone who's sick, again, doesn't hurt to just wipe everything down before you shower. So that is basically how, the bathroom should be run.
Right, and probably hand towels for the person who's sick. Rather
totally
than
separate set of towels.
So that they can all be discarded. Yeah. Don't share towels, whatever you do.
Right, of course. Do not share towels, please. Don't share anything. And something else to consider is if the sick person is in their own bedroom, I know that there's been a lot of talk about how animals can't get coronavirus, but again, the animals should not be going in and out of a room. Keep your pets out of the room. I know I would want my dog if I was sick, but dogs stay out of the room, cats stay out of the room. Really, that person needs to be in the room by themselves.
Right, and the reason is so that, they pet the dog, then you pet the dog. It's more that. And there's no evidence at all that dogs can get coronavirus. Actually, it appears that cats can. I don't know why, but apparently you can't transmit the tiger. Now, I don't know how they found a person to come within 6 feet of a tiger. That's something I never really had a desire to do.
Well, that's because you're not watching Tiger King, Dad.
I've not watched Tiger King. I don't really have an intention of watching Tiger King.
I don't know, man. I think you should. Okay, and then let's get back to it. So when you are washing your hands, again, important to sing happy birthday 2 times and wash your hands with warm soapy water. That will just help. And then again, if you're into this whole, nail brushing thing, or just wash your hands really close, you can get in your nails, or you can use your new handy dandy nail brush. But yeah, so that definitely works. But the number one thing is just move toothbrushes. Get your toothbrushes out of there, wipe things down like you would a treadmill at the gym, and do your best. Okay, so let's move on to medications that you should have at home. So these are not going to be anything fancy. These are going to be things that just kind of help with your symptoms and help you, feel more comfortable. So for example, cough drops. If you have a dry cough, cough drops are a really great option. So is tea with some honey, some ginger. I throw whiskey in my tea sometimes, but maybe not so much whiskey. But definitely tea and cough drops are a great thing to help soothe your throat and soothe that really harsh cough that can happen with COVID-19. Another thing is over-the-counter cold medications. So we're seeing, a lot of cold flu-like symptoms. So those over-the-counter medications, like we were talking about earlier, Tylenol would definitely be helpful. The next thing they recommend is a pulse oximeter and batteries. So you can actually buy your own pulse oximeter, which you put on your finger. I don't know if you've ever seen it in the hospital. It clips like this to your finger, and it basically gives you a reading of the oxygen levels in your blood. And so to keep an eye on those, you can see, how your oxygen levels are maintaining themselves or not maintaining themselves. The same way that you would track a fever to see if you have a fever, you can track your oxygen levels. And if they fall below a certain level, I would say if they fall below, 94%.
Yeah, I think that's a really good number. I think that for most of us, normally our oxygen level, even smokers, should be 94 above. If you start seeing it drop rapidly or you get down to 93 or less, it might be a good time at that point to go to the emergency room and seek medical attention.
Right.
Because they can actually drop fairly rapidly. Yes. Yeah, how you feel, of course, clinically, very important. Any
shortness of breath, always call the doctor. Of course, get a thermometer, keep an eye on your temperature, doesn't hurt. Saline nasal spray was on the list. And do you want to explain why saline nasal spray was on the list?
I think really just a matter of clearing the secretions. I know when I have a cold, it helps me feel much better. I don't know that it does anything else therapeutically, though.
Right. It's all just, I would say, therapeutic. Makes you feel better. The next thing would be, this is on the list, tea with honey. Always good one. Chicken soup. I made so much chicken soup. It's delicious. I don't have Corona. I just like chicken soup. And so that can bring us into nutrition. So on this list, were also daily multivitamins and vitamin C. This is if you're sick. Again, vitamins are never a bad thing to take, but I wouldn't really take anything without asking your doctor if you're already on a lot of different medications. Again, electrolyte drinks like Powerade or Gatorade, those are great to drink to kind of help bring your body's electrolytes back. However, and this was a fun fact that I just learned, they actually have a lot of sugar. And we are starting to see some gastro problems with coronavirus where you can get diarrhea, and sugar can actually make the diarrhea worse. So what they're saying to do is to do half of the electrolyte drink and half a cup of water, mix them together so that you can still get the benefits with not all of the sugar. So that's that. And then
Great
ginger.
idea.
Yeah, good idea. Thanks. I did not come up with it by myself. And also, let's go into the whole sugar thing. Anything that's sugar-free or artificial is also seen to, cause gastro problems. So I wouldn't, necessarily say, okay, I'll just get, sugar-free Powerade. That's not going to be the best thing for you either. But
right, I'd still cut it in half, dilute it with water, and that way you stay hydrated. Don't hydrate with just water alone, because when you're losing, if you lose stools, you're not losing water. So you want to have some electrolytes, but I'd probably cut it in half.
Yeah, definitely the electrolytes and, some orange juice, good fluids for yourself. And also the reason is because if you are dehydrated, you can actually worsen your fever. So drinking those fluids will really help keep all of that down and keep you feeling good and not, upset your stomach any more than it might be. The next shopping items on the list would be ginger, lemons, dill, and oregano. These are all said to have some antiviral properties, so can't hurt to eat, some chicken.
And if they don't, you can use them in oregano. A salad.
Yeah, use them in a salad. I'm like, ooh, what can I make? And lastly, avocados, honey, bananas, and apples, and even some applesauce. These are great things to keep on hand. if a lot of people, when they get sick, they lose their appetite. They don't really keep a lot of things down. So eating things that are very high in calorie and dense in nutrition, those are going to be the kinds of foods that you want to have in your refrigerator. And, you know, a lot of protein. Protein really helps the body recover, just like when we're exercising. When your body is fighting a virus, it is tired. You need sleep, you need rest, you need protein, and you need fluids. So you need to take care of yourself, and you need to be patient with yourself. And, you know, just make sure that you're doing your best to stay well, stay isolated, and stay educated on best practices. And that's a wrap for me.
No, great. Okay, now we'll go to overtime for a few minutes. Let's look at some of the questions we have on the right side of the page and see if any others have come in.
All right, let's see what we got.
Yeah.
Do you recommend covering your eyes when you're outside? That's an interesting question.
You know, with me, I wear glasses, not a problem. But yes, the eyes are a way you can get virus, and we know the face masks don't cover your eyes. So that's why many doctors in the hospital are using face shields. And there are many cheap face shields available. I would say it's not a bad idea. You can make a cheap one, and oh my God, there's so many recipes for that online. You just a little bit of any sort of plastic, keep it in front of your face. I would use that mask. Not a bad idea at all.
Yeah. Someone just posted a really interesting question that I don't know that either of us will have a perfect answer to, but I think it is worth talking about, is what can we tell our kids? I don't have kids, and I know I'm older, so, you know, maybe I understand it more, Dad, but if I was younger, if I was 5 or 6, and I was living through all of this, what's a better answer than just, we don't really know at this point?
Yeah, and well, thank you, Eric Brooks. Thank you for that question. No, it's really tough. The other thing is that, what if they're the ones with coronavirus? How to get a kid to wear a mask? I mean, it's very hard to do that. I think you've got to approach it with, you've got to be upbeat, you've got to be empathetic. You can say things. Listen, how many times are we going to have the time to spend at home with our children, where everybody's home? So you can make positive use of this time. Hopefully it will not occur again like this, but look at the positives you can take from this. The family time, having that time with your kids, do play games with them, do a puzzle. So just say, listen, we're being safe, we're doing this for the country, and I'm so happy to be home with you. You keep the message positive.
Yeah. It's also a really, really awesome, cool time to educate your kids on hygiene, how to wash their hands, how to stay healthy, all of that stuff, which are just, it's the first thing I learned in nursing school was hand hygiene. And it's sad I had to learn it in nursing school, but now, we're all really learning it a different way. So it's a great way to teach your children about viruses and science and make it exciting. I've seen some really cute videos about, teachers teaching their kids how viruses spread. And it's been really great to see all of that education going on.
Right. And we want exciting, but not scary, particularly with kids.
Right.
Paula Fink, hello, Paula. She asked, unwittingly, I bought gloves and masks from China. Are they okay to use? I mean, I think the gloves, you can look at the gloves and determine if they're okay to use. The gloves probably now masks. There are a ton of counterfeit masks on the market. So I would think that any mask you get from China is better than no mask, but take it with a grain of salt. You may not really have an N95 mask. I mean, I've been bombarded with people trying to sell masks. Who knows if they're real or not? I'm sorry, what about what?
Oh, 2 things. One, N95 mask. On a unit, when you get tested for an N95 mask, each person has to be fitted. That's because it's not a one size fits all. It's not small, medium, and large. It's actually fitted to each person. And then they spray, like a lemony spray. And if you can smell it while wearing the N95 mask, you've actually failed the test, and the N95 mask is not suitable. So these N95 masks are not a joke, and not just any N95 mask that you see on the market is real and is going to work. So again, that's why we're saving that N95 mask for real healthcare professionals that are, much closer to people with the virus.
And I think that's very fair.
Yeah. And I'm seeing, Dad, a lot of questions just about returning back to school and what that will be like. How do we put 30 to 50 kids in a classroom and, really ensure that everyone is going to stay healthy and, follow best practices. I guess, of course, maybe you don't know, but what do you think could happen?
I know. I see Kim ask that question, and I've discussed that online as well. But yeah, it's a problem. I mean, here you've done great social distancing. The kids are out of school till September, and the incidence of coronavirus is down. Maybe it's 5% of what it is now. But if you've got 30 to 40 kids and you're a teacher, you haven't had it, and you've got an empty ICU, you don't want to be occupying the bed there. So yeah, I think it's really a thing, and I think it's going to require widespread testing. In my vision, I think that we're gonna have like immunization certificates. Are you negative? Have you had the test? Are you positive? And maybe kids will need something like that to return to school, because we want to protect the other kids. We want to protect the teachers. We want to protect the kids' grandparents. That's not going away anytime soon. Even if we come off our current degree of social isolation, this is a big problem. There's no easy answer.
Right, and Karen also just asked, should we, keep wearing masks after COVID-19 is over? I think, unfortunately, there's not necessarily a specific end in sight for COVID-19, but, when you are traveling to work for the next couple of months, if your city starts letting, workers go back, practice some of the same things that we're doing now. And it's great that you can go to work, but still wash your hands, be careful with doorknobs. We don't really know, because when people are asymptomatic, they can still pass the disease. Right.
It's a long time before I'm going to be shaking hands or not wearing a mask. When I'm out in public, even when they sound the all clear, I'm wearing a mask, because this is not going to disappear anytime soon. When it disappears, well, we can think about it. But I think the word disappear is a long way off.
Right.
And with my patients, I always wear a mask too, and gloves.
Yeah. Okay, and what do you think? Do you want to take one more, or should we wrap it up?
We can take one last question.
All right, I'm going to let you pick it. What are you thinking?
Okay, let's take a look. Another test here is, couldn't they test for antibodies city by city? And I think that's true, right? We may decide that New York is on lockdown, but Bismarck is not.
Right.
The United States is a very big place, and there are outbreaks in certain areas. And I think you may see Florida now peaking in the near future. So you're right. I think it depends where you are, and that's why local officials have to all work together to determine what makes sense for them.
Right.
If you're in Montana, do you need to be as restrictive as New York? Montana is spread out. I mean, yes, all these things have to come into place. So thank you for that question.
Yeah, thanks. So we're going to wrap up, I think, for today. And again, though, just, something to keep in mind is keeping yourself educated and informed and up to date. That's why we're here doing these videos, because we know that last week we said something different than what we said this week. And we're learning the virus, all of us together. So stay informed, tell your friends.
Exactly. Please share the video. That's how we get more views. As long as we've got lots of views, last week we're at 1,400, we're going to keep doing these. But we want to wish everybody a happy Passover, Chag Sameach, and a happy Easter. And let's hope we have a good week, and we see that curve flattening even more by next Sunday.
Yes. Stay positive and stay safe and stay healthy. And if you think of another name other than the Finking Minute, we're definitely open to suggestions.
All right. Okay. Thank everybody.
Bye, Dad. Love you.
And goodbye. Love you too.
Bye, everyone. Bye.